Month of November is a time to bring awareness to one of the deadliest forms of cancer, pancreatic cancer.
Our Christina Laurie shares signs and symptoms of the disease and explains why it has such a poor survival rate.
One of the biggest problems when it comes to diagnosing and treating pancreatic cancer is that oftentimes the symptoms are so vague you don't realize you have it until it's too late. They're things like nausea, stomach pain, back aches, things you wouldn't even go to the doctor for, let alone a hospital. Other times, there may be no symptoms at all until a person develops fatigue, loses weight, or shows signs of jaundice, a yellowing of the eyes and skin. Pancreatic cancer is so likely to spread because the pancreas is nestled deep in the body and surrounded by lymph nodes and blood vessels. Doctors call it the highway to metastasis. Another problem with pancreatic cancer is that there's not currently a screening test for it. While there's the PSA for prostate cancer and the mammogram for breast, pancreatic cancer doesn't have any source of early detection. That's why only 10 to 15% of patients are diagnosed while the cancer is still contained in the pancreas.
There was an early morning when she called and let us all know that she was diagnosed with pancreatic cancer, and it's heartbreaking because most people, you don't see survivors of pancreatic cancer. At least back when she was diagnosed in 2009, I didn't know of any.
But here's the promising news. Thanks to the fundraising efforts of organizations like PanCan, researchers are learning more about pancreatic cancer and are making some progress. They now know that up to 5% of pancreatic cancer cases are hereditary and are providing genetic testing to families who may be at risk. In recent years, they've learned that people with a new diagnosis of type 2 diabetes or depression have a higher than average risk of being diagnosed with pancreatic cancer. While pancreatic cancer specialists used to measure their patients' life expectancy in months, they're now measuring that in years, and that is progress. Doctors here at UW's Carbone Cancer Center are also seeing similar numbers. This is where a third of all Wisconsinites are treated for pancreatic cancer. We will share more about the progress that they're seeing here in Madison tomorrow.
Christina Laurie, thank you. A reminder, Thursday is World Pancreatic Cancer Day, a day that encourages people around the world to wear purple for pancreatic cancer awareness.